Hi, Dr. Taylor here again, and we're going to talk about conversion from T4 to T3. So if you remember, T4 is the inactive form of thyroid hormone, where T3 is the active form. So when you're getting your TSH and let's say your T4 checked at your medical office, this is a big reason why they'll miss issues with low thyroid is conversion. Because if you're taking Synthroid, if you have levothyroxine, those are T4s. So even if you have those in your system, say with you've had a thyroidectomy or that's just the medication that they gave you, it's a T4 medication. So if you can't convert that, whether it's natural hormone or synthetic with medication to T3, you're always going to have issues, and this is why. So what you have is the pituitary, which is in the brain. The pituitary releases TSH. So TSH is a brain hormone, not a thyroid hormone. And TSH and the pituitary the pituitary regulates TSH based on T4 levels. So like say, if your T4 levels are fine, your TSH is always going to come back as fine. Your labs will always look normal. But if you can't convert to actual active hormone, that's where the issue comes in. So like I say, pituitary releases TSH. TSH goes to the thyroid, then your thyroid says, okay, we'll produce some hormone ourselves, and they'll release T4 and T3. So when it does that, it does 93% T4, which like I say is the inactive form, and then 7% T3, which is the active form. Now T4 will work a little bit on the cells, but not near as much as the T3. So you need to convert it to T3 so you can have active hormone in your system. So both of these hormones, T4 and T3, jump on thyroid binding globulin and go to different places. So thyroid binding globulin in itself could be an issue, which could give low thyroid, but we'll talk about that another time. So let's say your thyroid binding globulin is good, and it takes your T4 to the two biggest places that it's converted into T3. Now there are some others, but these are the two biggest players. So it takes it to the gut and the liver. So the gut, 20% of your T4 is converted to T3, and in your liver, 60% of your T4 is converted to T3. So if there's issues with these systems, you can see why low thyroid issues. So in the gut, T4 is converted to T3 on a enzyme called 5' deiodinase, so that you need that to actually work. Now this actual enzyme itself needs different cofactors to work like it's supposed to. So things that can affect it, let's say in the gut specifically, is poor absorption. So if you can't absorb these specific minerals and nutrients like you're supposed to, like vitamin A, D, zinc, and selenium, 5' deiodinase isn't going to work like it's supposed to. You're going to have low conversion. Or if you have dysbiosis in the actual gut itself, that's also going to affect conversion, and you're going to have low conversion from T4 to T3. Now if we move over to the liver, T4 to T3 conversion is also used with the 5' deiodinase, but factors. So you need dopamine, serotonin, iron, and selenium. So if you have low dopamine, serotonin, which could be like brain issues and things like that, that'll affect the actual conversion in the liver. But we'll open it up a little bit more. We say if you have high glycogen, so you can have high glycogen stores in your liver. So say you're diabetic, if you have high blood sugars, it gets really high, your body will store sugars, the glycogen in the liver, which decreases liver function, which will decrease your conversion from T4 to T3, no matter what this is looking like down here. Or let's say you have a lot of toxins in your body, whether that's mercury, asbestos, whatever. It could be a lot of different things. It could be a lot of more simpler things as that as well, but heavy load on the liver itself, low conversion of T4 to T3. Or iron. I know you need iron as a cofactor, but you can also have too much iron. So how does that happen? One of the most common ways is, if you eat a lot of fortified breads, what they actually do is they take rock iron, crush it up, put it in the breads, the cereals, whatever you're eating that's fortified with iron. The problem with that is rock iron really isn't a good form of iron for you to actually take in and use in your system. You don't use it very well, much at all. So what your body will do is it'll store it in the liver. You store it in the liver, guess what? Liver gets sluggish, doesn't convert, doesn't do what it's supposed to, not only with conversion, but a lot of different things. That creates an issue. So there's lots of different areas through the system where you can have low conversion, which will give you low T3, which is actual active hormone. So like say, as far as blood tests, TSH will come back as normal, T4 will look great. They'll say, you're looking really good. I have no idea why you're having, things like hair loss, weight gain, gut issues, all the plethora of things that come along with low thyroid. But these are the reasons why, and this is why we can help people as far as these issues go. So my name is Dr. Taylor. I hope that helps.